Hello, everyone. Let me turn on Facebook Live. If you are on Facebook Live watching this, then, well, actually, we haven't started yet, so that preface won't work yet. We're streaming here on Crowdcast, and now it looks like we are streaming on Facebook Live. We are. So if you're on Facebook Live and would like to join this conversation in real time, head on over to crowdcast.io/piware. That's Piware. And you can ask questions in real time to Dr. Stephen Feldman, who is with us. Thanks, Dr. Feldman, for joining us.
Yeah, my pleasure, Pi.
Dr. Feldman is a dermatologist with 30 years experience. He's been at Wake Forest University for 28 years. And Dr. Feldman was involved in Skin Deep. If you saw the film, you saw that he was the first thing in the movie. We followed him with our cameras, both in North Carolina and when he went to the Austin Morgellons Scientific and Patient Conference. And he actually gave a presentation at the conference. So thank you again. What's going on? It's April 11th. We're in the middle of coronavirus times. How is that going for you as a doctor?
Well, yeah, doctor life is pretty good. The university still pays me a salary. I don't go into work as often as I used to. I do more of my visits like this over the internet, talking to patients and caring for them as best we can without having them come in. The department has enough dermatologists that each one of us only has to go in 1/2 day a week to see the emergent patients who desperately need to come in despite the risks. And so we're still seeing them.
What type of patients are those that that have to come in?
So the first day that I saw those patients, it was patients with horrible inflammatory diseases, immune diseases of the skin, causing horrific ulcerations of the skin, other weird immune diseases, people on complex medical therapy, people who had acute rashes that needed a biopsy to better understand their disease, a couple people who had skin lesions that they were worried were skin cancers. Many skin cancers, you could wait a while, but others you want to handle as quickly as possible.
So things that you need to see and touch and deal with up close is what you're dealing with now in those half days.
Yeah. But, if you had something that you need to see and feel and touch, but you don't have to do it this week, you could wait a couple months. We're waiting a couple months,
Sure.
For everybody's benefit.
Yeah, absolutely.
We don't want the patients getting infected from us. We don't want us getting infected from patients. And every interaction between two people increases the risk to the entire community.
So if you have patients that you're seeing virtually, how difficult is it to diagnose over the internet?
I think a lot of the things we're seeing are return patients, who are, for example, I'm an expert on psoriasis. So I see a lot of psoriasis follow-ups. My patients are doing well on treatment. We have to, check them once a year. We can do that over the phone. We have patients with acne. We already know what they've got. We have them on therapy. We're rechecking them every month. We can do that over the phone. For new problems, it depends. In our training, we just tend to do a lot of our training, especially for rare conditions, by throwing up a slide, a picture of the rash or the lesion, and being able to recognize it. And so for a lot of things, you can do that, especially if the patient can send you a really good picture. Now, Pa, you're an Emmy award-winning filmmaker. What do you think the chances are that the lay public is going to take a picture of something and have it in the perfect focus that you want, and send it to you?
Yeah, I see what you mean. The quality of the photograph is going to make a big difference to your ability to diagnose it. Yeah. Absolutely. Yeah, that's. I actually ran into that a lot when making the film. People would say, "Hey, I'd love to show you evidence of the fibers in my skin or the Morgellons disease that I have. Here's my video." And then it would be of a quality that wasn't compelling evidence, right? So, yeah, we had to buy our own microscopes, come in with our own cameras, and really give the audience the experience of what we found when we were looking at it. I mean, we used microscopy and we saw these fibers in the skin. And in fact, you did at the Morgellons conference um, when you met with Cindy Casey and Nancy Egger. So I guess the big question is, what was your feeling about that? I think in the film there wasn't. You didn't find it compelling at the time, or it seemed like maybe in the room it was more compelling than outside of the room after you thought about it. Can you sort of elaborate on what that experience with Nancy Egger and Cindy Casey was? And just to remind folks what scene I'm talking about, I'm going to try this screen share and see how this goes. This is the scene. I'm sorry, that's not it. This is the scene that I'm talking about. I don't think you can hear. This is when they were looking at the towel, but this is the scene where Dr. Feldman and Cindy Casey were looking at the skin of Cindy Casey and finding these fibers. So that was my attempt there. I hope that worked, of showing you guys what scene we're talking about. Go ahead.
Yeah, the we saw fibers there, and there were some really terrible ulcerations of the skin, crusted lesions, and when the crust forms, and you have the congealed serum from the blood that's over a wound that's hard and protective, there were fibers embedded in that. You could see the fibers. I suspect that you take any wound, fall off a bicycle, scrape yourself, as that wound forms that hard crust, there's going to be fibers from your clothes trapped in the thing. I suspect blue, red, white fibers, it makes perfect sense that they come from people's clothes. It makes no sense that they're coming from some process in the skin. I think one of the people who studies these fibers found that they're made of keratin, which is hair protein. So some of these could be hairs embedded in the skin. I think if they're blue, it's more likely to be some wool, because what is wool? That's just sheep hair. And so a blue dyed wool fiber gets caught in the skin. It wouldn't surprise me. I don't find the fibers that is compelling evidence that there's some fiber related disease going on. And I think the scientists, if they were serious about, wanting to detect fibers and making some claim about their diagnostic significance, they would have to take other kinds of wounds that are totally unrelated and show that those similar fibers don't occur in those other conditions, which I suspect they probably do.
So to your point about the blue and the red fibers, if it was dyed, then there would be evidence of the dye. I know you had a debate during the film with Marianne Middleveen, who's a Morgellons researcher and a microbiologist, and she found from an independent lab that melanin was the thing, was the substance that was coloring a fiber that was taken out of skin blue, so that it wasn't a commercial dye that was creating the blue hue of the fiber, but actually a human process of melanin that was coloring this blue. Did you find that evidence compelling?
Well, if she's trying to say a hair got stuck in the thing, sure, but she's not claiming that. But what is a hair? A hair is made of keratin protein, and it's got melanin in it. So, and that
But
might be
that was
true of
a blue hair she was talking about,
yeah.
right? So
Okay.
the question. So I guess the question is, like, if you find a blue fiber within the tissue,
Mm-hmm.
and you analyze that in a lab, and the lab finds that the coloration comes from melanin as opposed to a commercial dye, wouldn't that be compelling evidence that the body's creating blue fibers?
Well, detecting melanin doesn't mean there isn't also some other blue dye that they didn't detect. I mean, you could have hair, and then which is the keratin, and it can have melanin in it, and it could be dyed as well if it was, from some sheep or other animal, some natural product.
Yeah.
But no, I would think that if you had a hair and you dilute the melanin in it, it could have a bluish hue, perhaps.
So when you arrived at the Morgellons conference, I'm sort of interested in your perspective. It's been a couple of years. That was 2017, I think, when we followed you through the Morgellons conference there in Austin, Texas. And when you arrived, you had a conversation with Harry Quinn-Shone, who's that medical historian philosopher, the guy from England. I don't know if you remember. You've seen the film, yeah?
Mm-hmm. Yeah.
So when you arrived, you seemed very open-minded and very interested in getting people's stories and looking at the science. But by the end of the conference, there was more of a sense that you thought it was a bit of a joke, and you were buying these bags, the Morgellons conference bags, as kind of an ironic gift for fellow dermatologists. What shifted for you throughout the time at the conference?
I wouldn't say it's a joke. I mean, you got patients there who are suffering with, horrible disease. So there's nothing jokey about this to me. Some of the stuff there I found offensive. There was an exhibit area where people are trying to sell stuff to these patients who are suffering. I remember specifically in Make It Into the Movie, the one guy selling vitamins, and he shows these beautiful graphs of how their vitamins can prevent the growth of the Lyme organism or Borrelia in the laboratory. But if you look closely at the graph, at the concentrations that were required to kill to prevent the growth of the bacteria, you find that the concentrations were such that you would probably have to eat your entire body weight of that vitamin and not pee it out in order to get the kind of blood level that was achieved in the test tube, which is just insane. It's to suggest to these people who are suffering that they should spend their money on probably some expensive vitamin supplement that has essentially no value based on science that's ridiculous, seems almost criminal to me. The fact that these, scientists who are, focused on Morgellons and are making these claims, not speaking out against that kind of misleading people, I just that part I found somewhat distasteful. I came away from the meeting with a different understanding of Morgellons. I think I went into it thinking people with Morgellons are mentally ill. And I left with the feeling that some of the people who claim to have Morgellons are mentally ill. Some of them have a drug-induced condition, and others have skin lesions, and dermatologists don't know why those lesions are there. And the patient is fixated on it being Lyme disease because of some evidence they've seen. I don't think that's mental illness or delusional. I think that's a difference in opinion. But there were clearly people there who were totally in need of antipsychotic therapy.
Well, I think that's clear in the film too, that the Morgellons disease name is attractive to folks for different reasons. Let's focus on the sort of the way I focused the film, which was to say, well, here seems like a credible line of investigation for certain lesions and fibers growing in the skin. We've got an interesting thing. So part of that scene that I showed everybody with Nancy Egger and Cindy Casey, I'll just pop that up again so you guys can see what I'm talking about. This scene here where, let's see, they're looking together at the fibers within Cindy Casey's skin. And then you have a conversation with Nancy Egger there, who's in the background there. There she is. She had a really interesting thing happen where she went and had she had lesions, and she had punch biopsies because they wanted to see what was inside her skin, what was causing these lesions. Actually, I'm going to share the screen again to show you this lab report, which she gave us permission to show here on the on this crowdcast. And can you see that PDF that I'm sharing?
Earlier, you were able to pull me up as full screen. Can you pull this up as full screen? Because it's so small.
Oh, let
I'm
me
having
see
trouble
here.
reading it.
Yes, good one. Okay, so how's that? Any better?
Oh, yeah. I'm going to pull up forward a little closer so the screen, you may lose me for a second here. From foreign body granuloma, slight chronic dermatitis. They don't see an ulcer, so they took the biopsy from maybe something next to the ulcer. It's gotten a little fuzzy here. Refractory and polarizable foreign material. So it's got
Refractal, yeah.
refractile polarizable foreign material. So there's some foreign stuff that's in there. There's a foreign body reaction around it, infiltration of certain kinds of inflammatory cells. Again, it got out of focus. Here we go. Epidermis slightly acanthotic, pericarditis, debris, no evidence of malignancy. Deeper sections are examined. Similar findings. The specimen considered does not show ulcer within surrounding disease. Yeah. So this biopsy shows foreign material, and the body's
Yes.
reacting to it.
And Nancy Egger claims that their reaction, her doctor's reactions, were, well, now we know you're crazy, because the only way that these fibers could have gotten into your skin is if you implanted them. So it was a kind of Kafka-esque thing where if we accuse you of something, you must be guilty, otherwise we wouldn't accuse you of it. Like they found fibers within her skin, and the reaction was the only way that could have gotten there is if you did it, not that they would come from the body itself. So
yeah, I didn't see the word fibers in there. I saw refractory polarizable material. So I don't know what was underneath the skin. But yeah, I mean, there's foreign matter there. It's not something the body makes. So something got in there. You know, I don't know that she necessarily put it there on purpose, but something got in there.
all right. Let's take a question from these attendees who have submitted questions. This one's from Lance. Lance has submitted many questions. I'm going to just pick a few, Lance, so don't get offended if I don't go through every single one. We only have about an hour and 15 minutes here with Dr. Feldman. Dr. Feldman, what scientific evidence would you require to satisfy the position that Morgellons disease is a true biological disease involving fibers growing beneath unbroken skin? What proof do you need, and what criteria must be met? There's already such a long list found at the Charles E. Holman Foundation.org research, where they have a lot of these papers that researchers such as Marianne Middleveen and Raphael Stricker have done. What is missing for you?
Well, the whole concept just doesn't seem plausible to begin with. I don't know how how a fiber could even be created underneath the skin like that. It doesn't make any biological sense. So somebody would have to come up with a simple biopsy of a lesion showing the fibers being made. There's nothing like that in the literature that I've seen. And I've tried to look at what these folks have come up with. The CDC, if they had found, I mean, they looked, they went, they took a whole bunch of people who supposedly had this condition and found no evidence to support it.
Right.
And
Well, let's take a look at
I don't
the.
know if you looked at the background. You've talked to me about my background, and when I went to look to see what scientific experience these folks had, and looking at their record of publications and what I could find about their background on the internet, the Lyme scientist that they're talking to, the first thing that came up was an issue of scientific misconduct back in the HIV era. Did you see that? About
I have seen that, yeah, recently.
that you didn't put that in the movie. I was
No,
wondering.
I didn't. I found it after we'd shot with him. Otherwise, I
Oh,
would have brought it up.
after the movie was done. Yeah, I mean, so uh, what would make me? I mean, if you showed me a biopsy of the cells making some fiber, yeah, that would be an easy thing to convince me that some fiber is being made under the skin.
Mm-hmm. So it's interesting you mentioned the CDC because we're in the coronavirus era. It's COVID-19 time, right? And we look at the CDC's reaction to that. And, as a layperson, before I started this, the CDC for me was kind of like, this is the top-notch institution that we should never doubt and always take their recommendations, right? That's just how it's sort of presented to me over my lifetime. And then when I began to study this, and even now that you see the coronavirus, you see that, oh, okay, the CDC can release a whole set of tests that are faulty. The CDC can change their recommendations and flip-flop on what they think is best. And it's not to say that the CDC are completely incompetent. That's not my point. My point is that they are fallible, that they make mistakes. And so when Randy Wymore from OSU investigated and was actually, I think, an advisor of some kind to that study that the CDC did on Morgellons disease from 2008 to 2012, he found that they had actually defined the population of Morgellons disease patients incorrectly, and that there wasn't about having fibers embedded in the skin. It was about the belief of fibers. And as you and I have already talked about today, it was, a lot of folks will take the term Morgellons disease and apply it to whatever they're thinking about. And if they're having a psychotic break and it's not related to an infection in their brain, then they're not true Morgellons patients. And what Randy Wymore and a lot of these other researchers have always been trying to establish, which is the same definition of Morgellons that began from Mary Lytow, which is that the definition of Morgellons are fibers embedded in the skin. And when the CDC studied people, they found fibers on top of the skin of only 12 people, and they tested those, and those turned out to be cellulose-based, so probably, like you'd said in the film, cotton and stuff like that. And so, my faith in that study is very, very, very low. And why would your faith in that study be so high is my question to you.
So I believe that we have, again, a distribution of people. There's patients who have delusions of parasitosis. Many of them are on amphetamines, and the amphetamines are driving their delusion. I'm pretty confident. And then you have people who have these crusted lesions with fibers stuck in them. And we don't know why they have lesions, and they think it's Lyme disease. I think it's unlikely that when the CDC went to capture this population, they only captured the delusional patients. Now, they may have captured mostly delusional patients, and they did find drugs in people, if I'm in a lot of them, if I don't remember the specific numbers, but not in everybody. So presumably they had at least some patients who had the lesions, and they didn't find any of them to be, anything biological causing the problem. So I think it's a great study for ruling out the possibility of an infectious cause of the condition in the vast majority of people who claim that they have something that's driven by something infectious in their skin. Now, that doesn't mean there isn't some small subcomponent that couldn't have something. I mean, we don't know what's causing the lesions in some of these people who have itch, and there's lesions, and there's crust, and there's fibers embedded in the crust.
So how did it go for you, the presentation? Like, what when you went to the Morgellons disease conference, You gave a presentation. How do you think it went? Like, what is your perception of that event?
Yeah, I I think it went well for the purpose of the movie. Uh, the When we were planning my participation, I think we came up with, I thought, a really good topic, which was how to have a better visit with your doctor, because um, patients who feel they have Morgellons often end up doctor shopping and don't have a satisfying relationship with one doctor, and I think they could, um, certainly more often than they do. And I put together, I thought, a useful, helpful presentation to help people who would be seeing a doctor make a better visit out of it. If I was talking to doctors about Morgellons, I would tell doctors what doctors need to do so that they would have a better visit with patients. But speaking to patients, I had a good presentation put together for how to patients could have a better visit. And but I think the presentation, either right before mine or right before the lunch that was before mine, was your presentation showing a trailer of the movie where I talked about how people with Morgellons are all mentally ill. And so I don't think anybody listened to my presentation at that point. I think they wanted to talk or scream about what I already said in the trailer, and paid little, if any, attention to the topic of my presentation.
That's really your perception?
Yeah, isn't that your perception?
No, Dr. Feldman. My perception is that you had a presentation that was for doctors, that you spent very little time rejiggering for patients, and then presented it, and had them at first, by the way, with your humor. I thought that they were interested. And then as time went on, and it was like a 60-minute presentation that ignored their sensitivity to what they claim is abuse of the medical system toward them, and was tone deaf and made jokes at their expense. And they reacted to that. And I think you may be right. With one person did react and say, like, hey, you shouldn't prescribe antipsychotics. And she was angry. And she was referring to that presentation that I'd shown before your presentation. But I think, by and large, I'm saying like 95% people were reacting to what you were presenting there. And to say something like, there are no bad doctors, I guess that's my question to you. What did you mean when you said to a room full of patients who feel like they've been abused by the medical system, there are no bad doctors?
First, let me just say, I love how your perception of this was so different than mine. And people look at the same thing and they see totally different things. And that fascinates me. And the second thing is, this is the first time I've heard you say that. And I wish I'd had that feedback much sooner. And I'd love to get that feedback from you in more detail, because that will help me do better. And now the third thing was your question, and I'm so old I've already forgotten what
The question is,
about
you
the bad
said,
doctors.
yeah. The
How could
quote
I
is,
say that
there
to
are no
you?
bad doctors.
Yeah, there
What did
aren't.
you mean by that?
What?
Wh-
So I am a test tube scientist by training. Protein chemistry of all things. I'm not a touchy-feely kind of guy. I'm not. I didn't go into medicine. I didn't get into medicine because I'm warm and fuzzy. I got into medicine by being really good on standardized tests.
Mhm,
You know, I take a standardized test really well.
mhm,
And they hired me at my university to see patients just a half a day a week. They wanted me to work in the test tube lab.
mhm,
But then I my colleague, the psoriasis specialist, left, and I became the psoriasis specialist the next day. Now, psoriasis is a chronic disease where we didn't have all the great treatments for it that we have now when I started. And so it involved a lot of hand holding, which I wasn't good at. But I thought, I'm going to be a great psoriasis specialist because I can make the diagnosis of psoriasis. I know what to prescribe. I'd walk into patients' rooms. I'd make the diagnosis from across the room. I'd write the prescription as I'm walking towards them. I'd hand them the prescription. And then I'd leave going, I'm a great dermatologist. I know exactly what they had, exactly what they needed. Then I started getting patient satisfaction feedback, and some of the patients liked me, and some of them said, I wouldn't send my dog to that uncaring jerk. Now, I care about my patients. I want them to get well, but patients had the impression that I didn't care about them at all because I just walked in and walked out. I'm sure I cared about them as much as anybody would, but I didn't leave them with that feeling.
Right.
So not only have I worked at making people understand how much I care about them, but I started a doctor rating website because that feedback I got from patients was so valuable to me. And so I've collected patient satisfaction data on doctors across America. I bought a list of all the doctors in the country. I attached it to an interactive patient satisfaction survey, and I collected data. And I could see what patient satisfaction is with doctors across the country. And I looked at the doctors who had 10 or more ratings to get a sense of the doctors who have enough ratings that it's probably going to be a representative score. I mean, you can't look at doctors with one rating because if only 1 in 100 patients doesn't like the doctor, well, then 1 in 100 of those doctors is going to get a 0. So looked at the ones who had a lot of ratings. And, I asked doctors, what do you think the average score would be? And the doctor said, the idea of online rating is terrible. Only unhappy patients are going to go do the ratings. The average score is going to be a 1 or 2. And I think the doctors are right that unhappy people are more likely to go do the ratings. Some of the more optimistic doctors said, the average rating will be a 5 or 6. The actual average rating of doctors who have 10 or more ratings is 9.5 out of 10. Patients absolutely love their doctors. It's hard to find doctors who have scores below 8. I'm a 9.3, which puts me solidly in the bottom half of doctors as far as their patient satisfaction goes. Doctors are doing a great job. You don't read about that. You read cover stories about doctors who abuse children. You read cover stories about doctors who give patients the wrong blood and kill a patient. You don't read about the millions and millions of normal office visits every day where the patients are happy. Even doctors don't realize how good other doctors are, because if a doctor sees a patient that another doctor saw for a particular problem, it's because the other doctor didn't fix the problem. So we only see each other's failures. We never see each other's successes. And so even doctors don't realize how happy other doctors' patients are.
So the question is, what did you mean when you said there are no bad doctors? I mean, because you just mentioned, we hear about doctors who molest children, or you hear about doctors in the news that do these horrible things. So my question is, why would you say to a group of people that feel like they're part of those those exceptions to the rule, where they didn't get a good doctor, they got a doctor, or they're a system, like a part of the system that doesn't recognize them and abuses them? Why would you say to them there are no bad doctors?
Because there aren't. There's the doctor who abuses children is so rare as it's not an issue. These patients who are suffering have been seeing doctor after doctor who's a great doctor, who 99 out of 100 patients who sees that doctor loves them. Something is going on in the interaction between that good patient and that good doctor that's leading the patient to be unhappy with the visit.
Could that thing be Morgellons disease that isn't recognized by the medical industry, like a legitimate infection that is yet, like ulcers back in the day, weren't recognized as a bacterial infection? When I was in high school, I was taught very clearly that it's a psychosomatic disorder, and you need, to reduce your stress to stop the source of your ulcer, when in fact it was a bacterial infection. So could this be the problem, that medicine understands something incorrectly, and that's creating the tension between a good doctor and a good patient?
So I'm glad you understand it's not a bad doctor. We've agreed it's a good doctor and a good patient and a bad interaction. So now I can go to meetings for doctors and tell doctors what they can do to have a better interaction. It doesn't help patients for me to go to their meeting and tell them what doctors need to do to make that interaction better. There's this Vietnamese philosopher who said, when the lettuce isn't growing well, you don't blame the lettuce. So you give the lettuce more light, more fertilizer. Saying you can only change the things you can change. So if you're a patient and you're trying to have a better visit with a doctor, there's do what you can to have the best visit you can possibly. Bad doctors are so rare that the chance that you would run into one and then another and go to 3, 4, 5, 6 doctors and not find a good doctor is statistically impossible.
Mm-hmm. Okay. Um, I I would you should we should talk. I should give you feedback. I would say if you do address another audience that has that feel like they've been abused by the medical system, I would be sensitive to that perspective and and keep that in mind when you address them, because I think a lot of folks were super offended and have a hard time when their experience isn't recognized or that it's cast off. And I think a statement like "there are no bad doctors" can do that, can cast off their heartfelt concerns.
Yeah, I see that everybody in that room is suffering. Some of them are suffering from horrible delusions that are causing them to suffer, and some of them have some kind of something causing skin lesions that's as yet undetermined that's causing them to suffer. If they want to have a good interaction with the doctor and get help, then coming in angry at doctors to begin with and acting angry at the doctor is not a great way to start.
What would be your recommendation, just as a so no I have a friend who always says, no contradiction without alternative. What would be your alternative? How would you set up a patient to have a better interaction with their doctor? What positive advice would you give them?
Yeah, well, start off, I'd go in with the expectation that they're a great doctor and I would trust them, and I would go in with a sense that I'm going to put my life in that doctor's hands and I'm going to do what they tell me to do. That's what I would do to start.
I think that's a good piece of advice for for psoriasis. Like if I get psoriasis, I'm going to use that, and I would go see a dermatologist. But when we're talking about a very exceptional case like Morgellons disease, which these folks believe, and there's research backing it up, that it's a bacterial infection probably related to Borrelia, that the industry hasn't caught up to yet. The medical industry isn't there yet. So that kind of like, I lay myself at your feet, great doctor who's been educated by a medical book that doesn't include my condition. Like it doesn't make a lot of sense for this particular population.
Yeah,
It sounds like you're
convinced that it's a bacterial infection caused by Lyme. Is that are you
Well, I'm not
saying
saying
that
it's
that's what
caused
it
by
is?
Lyme, but having researched it for 5 years, the most convincing explanation that I found was that it looks like this is a bacterial infection that's causing the body to react by producing fibers, similar to like bovine digital dermatitis that has a spirochetal infection within the leg of a cow and produces lesions in keratin, fibers made of keratin within that. So there's a case within the animal world that's analogous to what the scientists are proposing is what Morgellons disease is.
No, it's not analogous at all. It looks what they were proposing, this fiber thing in the animals, it looks like a wart. It's like you've got like a warty thing with fingers of scale coming off of it. It doesn't look anything like Morgellons disease. I tell you, Pi, what I would say is you need to trust me on this. You need to talk to me about your evidence and let me show you how poor the evidence is. I mean, the evidence, you're talking about papers published by a guy who admitted scientific misconduct, and the scientific misconduct he admitted to, as I understand it, was throwing away the stuff that didn't match his pre-existing hypothesis. Am I correct about that? Is that your understanding as well?
Of So the stuff that happened in the 80s, I mean, I didn't bring that paper to the table tonight to talk about. I thought we were going to talk about Morgellons disease and not just one particular scientist, but the
Well, I'm
papers
talking about the,
themselves.
yeah, well, I mean,
I mean,
the,
I'm
the
sure we
stricker
could
name
find
is on a
something
lot of those
within the
papers.
reputation of someone else that we could bring up and say like, well, then you can't listen to any of the science. It's like,
Yeah, I agree with you on that
I
point.
don't think we need to reputation bash at this point. I think we should just talk about, you know, if we
Yeah.
want to, like,
So,
what
so let's look at the PCR studies.
my question
If
to you
you,
is,
if
if you had a, yeah, go ahead, go ahead.
Yeah, if you look at the PCR studies, if you want a PCR test to come out in some predetermined way, it's likely to come out in that predetermined way because it is so extraordinarily sensitive. What the PCR does is it looks for the a specific part of the genome of some organism you're looking for. And it makes copies of that. And it makes millions, billions, trillions of copies, billions of trillions of copies of that genome, of this little tiny piece. And they can float around in the lab. And once you contaminate, then it's going to make all your other ones positive. And so if you tell your lab tech, I think we're going to find Borrelia in this specimen, you may well, that your lab tech may come and say, hey, look, I have a positive result. And I've actually seen this happen where one of my colleagues told the lab tech, I think these kind of lesions will have wart virus in them. And the tech didn't find wart virus, so she ran it again. But in the process of running again, it becomes contaminated from the previous positive control. And sure enough, she went back and reports to him it's a positive result. So seeing these people come up with positive results and the CDC come up with negative results, I trust the CDC's judgment on this a lot better.
Okay, so I think we can rest assured that you trust the CDC on this Morgellons disease more than you trust the research of that was presented in the film.
Gosh, yes, you saw the pic. You included in the film the picture of the hooves with these scaly projections coming out that almost looked like ginormous warts. Yeah, we understand warts. Okay, fine. But blue, red, and white fibers under the skin, different colored fibers, makes absolutely no sense biologically to have these different colors forming. It makes perfect sense if it comes from your clothes and gets embedded in the crust. The whole thing makes so much sense if there's something coming from the outside getting embedded in these crusted lesions.
Well, sense is
There's
subjective, don't you agree? I mean, it makes sense that the world is flat because I go outside and it's flat everywhere. It makes sense that the sun revolves around the earth because I can see it do that. Yet there's a complete perspective shift when you find out the science of something that didn't exist before it was discovered. And we know now the earth is flat, though it doesn't appear to be just from looking around, and it makes
No,
sense.
we know it's
You know,
not
so
because of science. And science, we
mhm.
have this woman's biopsy. It doesn't show, it shows a foreign body reaction. So there's
Mhm.
something foreign in the skin and the body is reacting to it as something foreign. It does not show the human body making a fiber. The science is right there in front of you, showing you that these are foreign materials.
Okay. Let's do another question here. If a patient is, so this is from Nancy Egger. Oh, hello, Nancy. If a patient is coming to see a dermatologist for an issue with their skin, why does the dermatologist refuse to examine the skin? And do you now look at the skin with a higher magnification than the 5 times magnifying glass that you talked about at the conference?
Yeah, I think dermatologists are doing a great job. They're examining patients. They're looking for skin cancers. They're trying to figure out the cause of things. I think if a patient goes into a dermatology visit thinking that dermatologists aren't going to do their best to figure out what's going on, then that may predispose the patient to having a less than optimal experience right from the get-go. Do I examine the skin with something more sensitive than a 5x lens? Normally not. For the vast majority of the purposes in dermatology, I can tell most of the things that I need to tell from quite some distance. when you're looking at trying to decide if something is the Mona Lisa or not, you can look from across the room. You go, oh, that's the Mona Lisa, or there's a helicopter over there. You don't have to get right up on it to tell it's a helicopter. Now, if different things need different levels of examination.
So I guess that's the question here that comes up next, which is the different levels of examination, right? So if Morgellons disease has fibers growing within tissue, and it would need a different level of examination, right? So say you're looking for the Mona Lisa, and there's another painting that's similar to the Mona Lisa, right? So what I'm suggesting is that Morgellons disease, if it's a true bacterial infection and it's causing fibers coming out of the skin and that causes those sensations within your skin, it's similar to the kind of formication that happens if you're withdrawing from crystal methane, or if you're have delusions of parasitosis. But it's not the same, according to this theory, which we follow throughout the film, that it's a biological sourced disease. So the different level of investigation, of magnification that you would need could be greater than 60 or greater than 5x. So Tracy Bruce's, this is Tracy Bruce, who you actually examined in the film. She is the patient who you spend the most time with in the film that we left in the film. And her question is, why do you not lean on the side of caution, since you are dealing with diagnosing patients as delusional, and use a 60 power or higher scope to your advantage, using it as a tool to show the patient they are wrong? They are not fibers, they are delusional. Just a little bit more. Would this not be a great way to prove you're right and help the patient understand they may be delusional? This is suspect that dermatologists refuse this simple request to view our skin with the 60x or higher scope that will prove you are wrong.
So you covered a lot of things. My impression of your movie was very different from what you just said. I thought the movie was fairly well balanced and didn't suggest that this is a biologic condition, that there's differences of opinion about it. One reason not to look for, now again, and then in your question you said the bacteria causing the body produce fibers. We just seen what the pathology report shows. It does not show the body producing fibers. It shows the body reacting to fibers that are not even to fibers, the body reacting to foreign material. The foreign, if I were to fall off a bicycle and get sand or something from the road embedded in my skin, it will form these foreign body reactions. That is the kind of process that we just saw, is how the body reacts in the biopsy there. It did not show a follicle generating a fiber. It didn't show anything generating a fiber at all. So let's be clear, there's no evidence the body is generating fibers. Now,
well, I think the misunderstanding might be that, what they call a foreign body is their perception of a fiber, right? So the words foreign body in that lab.
But the reaction to it, you've got the same kind of immune reaction around that in that biopsy that you get with any other foreign body.
Well, I don't know what to say to that. Let's continue with the question, which is about understanding, investigating with a 60x.
Yeah. So while when you do a test, because it changes what the diagnosis will be. And so it will have to have a certain level of positive and negative predictive value. You want a test that says, if the test is positive, I have this. If the test is negative, I have that. And we don't have that here. If you take a 60x lens and run it over lesions, you may find fibers on the surface of the skin. Does that tell you the patient has Morgellons? No, you probably find fibers on the surface of people with psoriasis, eczema. Anything that's weepy and crusty is going to collect fibers. Examining the skin with a microscope may be beneficial, but not because it's going to help tell you whether what the disease is. Examining the skin with a microscope, I might tell physicians is a good idea because your patients want you to do it. And it might help you develop a better relationship with your patient. And it may be valuable in that way. But no, it's not going to tell me whether somebody has Morgellons or not.
Okay, next question. The Tulsa, Oklahoma Police Department investigated Morgellons fibers and found no match in the FBI database. They concluded the fibers were consistent with what the body is producing and are not synthetic or man-made. Despite this evidence, you insist Morgellons fibers are from clothing and textiles. Where is your scientific evidence to prove the FBI and police wrong? From the
Yeah, I'd like to see the FBI report. I haven't seen it. It wasn't in the movie. I don't know if you have a copy of it that you could pull up and show us. But even if these things were hairs generated in the skin, that it's melanin and keratin and hair, why didn't the FBI say that it was hair? So there's something totally screwy about this that makes it totally untrustworthy.
Okay. Dr. Feldman, it states clearly that before a diagnosis of DOP is given, that all other possible diseases should be investigated. Why then are we all being labeled delusional when tests for other possible diseases are not being carried out? From
Well,
William Windsor King.
I don't know that that's true. I can certainly tell you when I have a patient who comes in who's clearly delusional, we do our best to figure out why they're delusional. We try, if you're on amphetamines now, and you might want to think about coming down on the level of amphetamines. There are those people who have itchy disorders of the skin that have lesions, and we don't know why they have lesions, and they may see fibers embedded, and they may be convinced that this is Morgellons. I would certainly try to figure out why they're having itching. We will do everything we can to give patients great medical care. I think doctors do in general. I think if you come to the doctor absolutely convinced that you have Lyme disease based on the evidence, and you give the doctor the impression that you don't respect their judgment and training, then you're going to make them feel the same way that you feel when you get the impression that they don't trust your judgment and the research that you've done.
Okay, here's a good question from Jeremy that I hope I can pronounce it correctly. Question for Dr. Feldman. What all can you tell us about prurigo nodularis, and how would you describe the artifacts that PN patients pick out? Do you know that term?
Yes, prurigo nodularis. This is a very common condition. Prurigo nodularis is a bump. They say that dermatologists are doctors who tell you in Latin what you just told them in English. If you tell the doctor, I got this itchy bump, they might tell you, you have prurigo nodularis. Prurigo nodularis means itchy bump. Prurigo means itch. Nodularis means nodule or bump. It's an itchy bump. And what happens is, to cause prurigo nodularis, is if you have something that caused itch. It could have been a bug bite, could have been anything that caused itch, and you scratch it. The scratching might cause more itching, and the itching causes more scratching, and you get in this vicious cycle, and then the skin forms this bump in reaction to all the scratching. And so that's what a prurigo nodule is.
Okay. Another question here from Sarah Victor. If the CDC suddenly agreed Morgellons is indeed a systemic infection and not a delusion, would you, doctor, change your opinion on the disease?
Yeah, I'd want to see why they said that, and if it sounded reasonable, yeah. I think right from the get-go, I think we need to make sure that we understand what we mean when we say Morgellons, because it means different things to different people. Some people who think they have Morgellons are absolutely totally delusional. When I was at the Morgellons meeting, Dr. Smith there, when we were talking privately, said, "Yeah, that one over there, that guy is delusional. That's not what we with Morgellons have." And people like that are giving the rest of us a bad name. So there's people with psychiatric illness who have stuff in their, who think they have worms crawling in their skin when there's no worms there. And that's delusions of parasitosis. There are people who are pretty well functioning who are on too much amphetamines. And I wonder if doctors are giving people too many amphetamines for ADHD, attention deficit, because I see all these people. But again, I only see the ones who complain of the skin issues, but they're on what may be high doses of amphetamines for ADHD, and they have symptoms, the description of delusions of parasitosis. And then we have this group of people who have skin lesions. They may or may not itch. They may or may not have fibers embedded in these crusted spots. It's causing scarring. They're suffering. There's no question they're suffering. And they are convinced that what they have is Morgellons disease. And some of them feel like they know that it's caused by a Borrelia infection. So we need to make sure we're talking about the same group. If you ask a doctor about Morgellons, they may be thinking about the delusional end of that spectrum and not about the end of the spectrum of people who are well informed. They've looked like you have pie at the data, and they are convinced by the data, even though the doctor would be totally unconvinced at the poor quality of the science that was done. I mean, the articles that, that are shown are not in top flight dermatology journals, much less the New England Journal of Medicine. The best article, the article that was in the best journal that the peer reviewers thought, was the best science, was the CDC's article.
Well, not every doctor is going to have the same opinion as you. I know Dr. Lisa Benest, who's a dermatologist in Burbank and I guess an ambassador to the, I'm not sure the exact name, it's the Board of American Dermatology or the American Dermatology Association, whatever the national sort of organization as a dermatologist. I spoke with her, and she is convinced of the data and is convinced, having seen it in her clinic, and she gave us a nice quote for the film, having seen the film, and was convinced. So certainly not every doctor and every dermatologist. And I've also heard reports, I haven't confirmed them, but I've heard reports of dermatologists talking at conferences and saying, this thing is real, and then sort of being not shouted down, but disbelieved and encouraged to be quiet because it's something, that's considered absurd. Like you say, it's weird. I mean, it's hard to fathom that the body would create blue and red fibers. That does seem it does seem weird. There's no question about that.
Yeah, I mean, it's impossible. It's ridiculous.
Well, I mean,
it's
that's
insane. It's almost insane to believe that the body's going to make these different colored fibers, and in the face of, especially now that you've seen what the pathology report looks like, it shows a foreign body, reaction.
What was considered a foreign body by the lab. Yeah, sure, I get it. I mean, it does it. They didn't say like foreign body and then describe what the foreign body is down to its composition and said it turned out to be a piece of glass. They said foreign body. So that's not a convincing argument on your side that this is not a fiber.
Oh, it is a fiber. There's fiber. You see fibers. Sure. They're not being made by the body, but there's fibers stuck in there, and they're hairs, a lot of them. Some of them aren't. The CDC found other kinds of fibers, but the best researchers seem, the people who are claiming that it's some fancy new disease, the best that they can come up with, that it's consistent with a hair stuck in there.
Have you had any Morgellons disease patients since we filmed together?
Well, I want you to be more specific about what you mean when you say Morgellons. I've had delusional patients come in.
Well, that's what I'm curious about.
Come in, and I've had patients who have crusty lesions and itching and of unclear etiology. I don't even want to use the term Morgellons for that. If you want to use the term Morgellons for that, you can. They have crusted lesions of unclear etiology. And I've seen 1 or 2 patients like that as well. Sure.
Okay. So did you ever get to the bottom of those encrusted lesions with unclear etiology, or it's still unclear etiology?
Yeah, I don't know what's causing them. Some of them are probably self-induced from the itching. I mean, these people have itch, and they have lesions that have sharp borders, lines, as though they've been dug, and treatment with patches that cover the lesion and keep the off of there, and along with anti-inflammatory medication and other treatments for the itch result in improvement. Yeah, I've seen that. But again, could some patients have a reaction to staph infection in their skin, to what the CDC might be considered normal bacteria, but this particular patient has an unusual reaction to staph infection and need an antibiotic to help control their disease? That could be, that's not outside the realm of possibility. And so, I think going to a doctor and being confident that based on your knowledge of all the data that you think it's Lyme, but open-minded that it may not be, is not a bad way to go into the visit.
So the film presents both sides of the debate, and you saw it. Your reaction was that it presented a difference of opinion, and a lot of I've been really interested, because it's always like, how do you don't want to color how people perceive the film, but you also form your own opinions as a filmmaker, and so there's always that delicate balance. And so I've shown the film to a lot of people, and not that many people have the same reaction you did. A couple, like I'd say, around 2 to 3% are like, yeah, it's a film about a difference of opinion, but I fall on the side of, this is probably delusional. The vast majority seems to think that, yes, while they present both sides, it seems pretty clear that this is like another cycle of medical denialism, and that there's a real disease here that's causing these symptoms. So how would you react to someone like that, an audience member like that, who had that opinion?
Yeah, well, everybody on this spectrum has disease and is suffering. There's no question about it. Some of them are suffering from delusions. Some of them are suffering from drug-induced delusions. And some of them have some kind of condition causing itch, possibly itching, but lesions and sores, some of which they may have self-induced, some of which may be occurring from some other reason that I don't know what's causing them. So yeah, I mean, if people come away with that, and that dermatologists don't know what's causing those lesions in some people, that's entirely reasonable. If they come away with the idea that everyone on this spectrum has chronic Lyme disease, well, then you've done a poor job, Pi.
Do you believe in chronic Lyme disease as an actual disease?
Yeah, I think there's chronic Lyme disease. Yeah, I think that's well accepted in the medicine. I don't know a lot about it. I don't know that it has much in the way of skin findings, and if it is possible that chronic Lyme disease can result in chronic itching and sores to form, wouldn't totally surprise me. If it accounts for a small percentage of the ones that we see, that may be. The CDC they looked carefully with really well-designed, controlled studies, blinded, and they didn't find anything. And so the likelihood that the amphetamine-induced people have Lyme disease, I think, is essentially zero. The likelihood that the truly delusional people have chronic Lyme affecting their brain, which somebody suggested at the Morgellons conference, seems ludicrous to me. The idea that some of the ones who have sores of their skin might have chronic Lyme disease, I guess that's possible.
How do you feel like it's gone since you started that website and you created the kind of scripted interactions that we show in the film with patients? Has that continued to be successful for you in the practice? Do you feel like you're still on a continuum, like getting and improving your bedside manner, or have you kind of like leveled off and you're like at a good spot?
You know, Pi, I suspect that I'm doing my best, but I'm not ever going to be the warm, touchy, feely person that some patients want. And one of the reasons I suspect that is because of our interaction here. I suspect when we finish, you're going to get on the, we'll get on the phone and you'll say, Steve, despite what you told me, despite what I told you about how you came across at the meeting, you came across the same way on this video. You still didn't come across as being caring and understanding of how people are feeling. I'm maybe a little autistic, I just tell people how it is and how I think. And if I could do it in a warmer, more caring way, making people feel like I was touching them, I would like to do that. And look, I recognize that people with Morgellons, wherever they are on that spectrum, are suffering. And when those patients see me, I like taking care. Other dermatologists don't like taking care of them. I like taking care of them because I know how much they're suffering, and I want to see my patients get well. And I go for the truly delusional person. I go out of my way to give them my cell phone number, which I don't know how many dermatologists would be willing to give a delusional patient the cell phone, so that they can call me if they have any questions, if they're having symptoms. I want to make sure they take their medicine. I want to do everything I can to help them. But it's continual learning for me. And so, yeah, when this is done, if you're an objective observer of how I'm doing, I would look forward to the feedback.
Right on.
I think nowadays, when I walk into a room, I make a big deal of putting that alcohol on my hands, as you saw in the movie.
Mm-hmm.
And, patients who've seen me the last few years, now that COVID is going around, probably every one of them remembers, I remember when Feldman did that. I don't remember the other doctors doing it. So, some of the things is probably that aspect of being scripted, I think, is valuable still.
Yeah, no, I think that does instill in them a sense of he's concerned about hygiene and about my well-being as a patient when you come in and you immediately sanitize your hands. And I guess it's just in the long run, when you script a sense of empathy, it works for these short periods of time, and it works, I think, for regular patients with regular diseases that you recognize and can treat or manage. And then in these exceptional circumstances, it's like in the movie when Edward Hu talks to his brother, Brian Hu, who's a doctor. And he says, look, Brian, you're a doctor. You're great. 99% of the time, you do fantastic work. But this 1% of cases that fall through the cracks, we're getting devastated. And I would encourage the open-mindedness to that perspective, because I think medicine, from what I can tell, and I'm again not a medical historian, I'm a filmmaker who studied this for 5 years. That's the extent of it. But what I studied is that medicine gets reinvented every 20 years or so, and the understanding. So what seemed ridiculous, and in fact, Dr. Berger brought this up in our interview. But it didn't make it into the film. But it was this thing where he, what seemed ridiculous at the time became established fact in the 1990s. So at the time he was in medical school and he was studying, they were talking about ulcers, and there was this guy, Barry Marshall from Perth, Australia, who was saying it was a bacterial infection. And his teacher stood up and was like, and he's insane. It's so ridiculous. And it affected Dr. Berger at the time, who was in medical school, because it was the very idea that bacteria could survive in your gut was bonkers at the time. And so the emotional outburst and the kind of ludicrous feeling it had changed over time. So I would advise to keep an open mind about what seems insane now, especially if there's people pursuing the research, because it may just be the standard operating procedure in 20 years, you know?
Yeah, it is not so ludicrous to think a bacteria could learn to live in an acid environment. The idea that the body is making blue and red and white fibers has no biological basis. So let's keep an open mind. And about this spectrum that I would love, I don't know if you can do a poll on this Crowdcast thing.
Yeah.
But you might just
I can make one right
poll
now.
people. Yeah, poll people. How many of our listeners are on a psychoactive substance? You know, how many take amphetamines, you know, of one form or another, or, you know, narcotics for back pain, or, you know, Xanax, anti-anxiety drugs. I'd be interested to know.
How do you spell Xanax? I'm typing this in right now.
Well, Xanax is Xanax, but it could be anything, for any medicine for anxiety, or in an ADHD drug, an amphetamine, or a narcotic. Any of those. It would be
I've got the question
interesting
here.
to know. You know, so you
We
asked
can all
me.
come back and take the poll. Just all you listeners out there, go ahead, take these polls that we have at the bottom of the page. If you're on Facebook Live, you'll have to go to Crowdcast, but you can rewatch this on crowdcast.io/Pieware, and you can look at the chat that was streaming down. You can replay this conversation, and you can also take the polls. So just to make it clear, are you on any psychoactive substance or take narcotics or Xanax or anxiety medication? How's that for the question?
Or amphetamine.
Or amphetamine.
Yeah. What is the usual amphetamine? Adderall, I think, is real common nowadays for people to take.
So they'll have a yes and a no. And we'll see if we can get the data on that. And you can check back, Dr. Feldman, if you'd like to. These polls are open to everybody to check on.
Excellent. Yeah. So the, you know, if you had somebody who is on narcotics or amphetamines, and the amphetamines are causing them to have delusions of crawling sensations in their skin, they're certain to have a worm. I think that the things I do to establish empathy, it's a continuing thing that I do with patients. You know, I can't walk in the room and tell them, oh, you're on too much amphetamines, it's causing your symptoms, and expect that they're going to believe me. I have to have a warm, caring relationship with them to get them to do it, and I do my best to do that.
All right. I think we got 4 votes already for no and 0 for yes on the question. So we'll let that count
how
out.
many, do we know how many people are listening?
We have 15 live
15?
attendees.
Cool.
Yeah. Okay. Is there anything else you'd like to add before we end our interview, as I usually ask in the interviews? Anything else you'd like to say?
Well, I would just reiterate the point that the main reason that I thought I could bring some benefit to the Morgellons meeting, which again is how to have a better visit with the doctor. And again, I would tell the doctors they have to be more caring. I know patients with Morgellons are suffering. To have a great visit with the doctor, it's not going to work to just keep going to doctor after doctor. I mean, if you know you're not going to be happy because you're absolutely convinced that what you have is Lyme disease, don't try to convince a doctor that you have Lyme disease. go ahead and try to find a doctor online who believes that Morgellons is Lyme disease. I think that they're largely quacks, but if that's what you want, just go ahead and start with them. But if you're interested in getting great medical care, I think you can still do that in the context of a belief that you have Lyme disease by having an open mind and listening to the doctor and sharing information with the doctor. But once you tell the doctor, I am convinced I have Lyme disease, I think that creates a problem. Well, if you say I'm convinced I have Lyme disease and you're not going to convince me otherwise, well, then you're likely not to have a good experience.
Thank you for that. I think that's helpful for people, and thank you for participating in the film, and for hosting us when our cameras came into your house. It was a great experience for us, and thank you for participating in this Q&A. I really appreciate it.
Oh, and I feel completely likewise. It's so exciting that I got to work with an Emmy-winning director. It was just a wonderful experience for me. Thank you so much.
Thank you, Dr. Feldman, and take good care, and stay safe, sane, and sanitized.
Yeah, everybody wash hands.
That's right. Thank you very much.